size examination. Part 1. Introduction. Vital signs examination. Vital signs are a measure of whether a person's life is normal and are the primary assessment of a physical examination. It includes body temperature, pulse, respiration, and blood pressure.
It is an indicator of a person's viability, and it also indicates a state of changes in physical, mental, and emotional. Changes in vital signs will affect bodily functions. Part 2. Preparing for vital signs assessment. 1. Wash the hands before preparing equipment. 2. Prepare complete equipment according to the patient's condition. A rectangular tray, a container for clean cotton balls, and another one for disposal use. Cotton balls or tissue, a glass mercury thermometer, a watch with a second hand, a blood pressure monitor, sphygmomanometer, a stethoscope, cotton balls moistened with 70% alcohol for wiping the stethoscope, a dry cotton ball or tissue paper for wiping the thermometer before reading the barrier. Part 3. Vital signs assessment procedures. 1. The nurse introduces herself, asks the patient's first and last names, and explain the purpose of the vital signs measurement. 2. Inform the patient before providing nursing care. 3. Assess the patient's physical conditions, such as areas to measure blood pressure, oral cavity, armpits, wounds, activities or exertions, eating or drinking, before measuring vital signs, and a history of easy bleeding. 4. Position the patient in a comfortable and safe position, either sitting or lying on the back. 5. Wash the hands before measuring vital signs. 6. Measure the temperature in the armpit by wiping the thermometer with an alcohol cotton swab by rotating it from the tip of the bulb up towards the handle. 7. Check for mercury in the thermometer below 35 degrees Celsius. 8. Open the patient's armpit. If the armpit is wet, use clean cloth to gently wipe the armpit area to dry. Insert the barband of the thermometer in the center of the armpit. Advise the patient to clamp the armpit tightly by placing the arm on the chest for 5 to 10 minutes. In case of the patient is restless, unconscious, or in young shine, the nurse should hold the thermometer and have the patient keep their arm closed throughout the measurement. Measure the pulse rate using the fingertips of the index, middle, and ring fingers placed on the radial artery. Press gently to feel the expansion and contraction of the artery wall. Do not use the thumb to feel the pulse. Count the pulse until 1 minute. Observe the characteristic and the rhythm of the pulse, whether it is consistent, light, or strong. 11. Check the respiration continuously from the pulse count, with the hand still pressed on pulse position by looking at the movements of the chest or abdomen. Count the inhalation and exhalation to 1 breath and last for 1 minute. Observe the shallowness, deepness, and the regularity. of the breathing rhythm. 12. Inform the patient the pulse and respiratory rate results. 13. Gently remove the thermometer from the patient's armpit. Wipe the thermometer clean with a dry cotton swab or paper towel from the handle side towards the bulb end. Dispose the used cotton or paper towel in the infected trash.
14. Raise the thermometer to eye level. Read the maximum value of mercury on the thermometer. 15. Wipe the thermometer using a cotton with 70% alcohol.
16. Check the mercury in the thermometer to below 35 degrees Celsius. Then keep in a clean container. 17. Measure blood pressure by positioning the patient in a comfortable position in the supine or sitting position. 17.1. The patient's arm is on the side of the body. Extend the arm to be measured in a comfortable position with palm facing up. Roll up the sleeve of the side to be measured above the area where the cuff will be wrapped. Arm must be at the same level as the heart. If in a sitting position, place the arm on the overbed. 17.2. Place the pressure gauges at the same level as the heart, especially the BPR monitor, that is the mercury type, should keep the eyesight at the same level as the scale to be read. 17.3. Choose the appropriate pressure cuff size. Wrap the cuff around the upper arm to be fit, but not too tight or too loose, and fix the end neatly for 1 inch above the elbow. Do not wrap the cuff over the sleeve. 17.4. Make sure the mercury or index of the meter is in the default setting. If it is not, expel air from the cuff by unscrewing the pressure control valve, or squeeze the cuff tightly to get rid of all the air. 17.5. Find the location where is the maximal pulse of the brachial artery. Turn the pressure control valve off, then switch the rubber valve to increase the pressure in the cuff until the brachial artery is unable to feel the pulse. Read the pressure value at that point to estimate the systolic blood pressure. In the event that the previous blood pressure value has never known, then switch the rubber valve to increase the pressure by 30 mm mercury. Finally, slowly release the pressure from the pressure cuff to measure the systolic blood pressure by palpation the pulse. Wait for 1 to 2 minutes, then repeat the measurement by listening the pulse again. 17.6. Measurement of blood pressure by listening. Squeeze the rubber ball to increase the pressure in the cuff by 30 mm mercury, higher than the systolic blood pressure measured by palpation. In case of knowing the patient's baseline blood pressure, the pressure can be pushed by 30 mm of mercury, higher than the baseline pressure or about 150 to 180 mm of mercury. 17.7. Measuring the blood pressure by listening should gradually reduce the pressure from the cuff regularly by 2 to 3 mm of mercury per second while listening to the carotid cuff's sound for readings the systolic and diastolic blood pressure. 17.8. Release the air out until the mercury or the index is in the default value. Remove the pressure cuff and keep it in order. 17.9. Inform the patient the blood pressure value and arrange patient in a comfortable position. 17.10. Wipe the stethoscope with 70% alcohol cotton. 18. Accurately interpret data from vital signs measurement. 19. Inform the results of the examination and give advice on self-care or prevention for the abnormality of the vital signs. 20. Clean the user's equipment and store it in place. 21. Wash the hands after nursing practice. 22. Record the measured vital signs on the patient's record sheet.